Good day, ladies and gentlemen. My name is Elayuka Esther, and I'm the Program Officer for Shunamite Foundation for Women and Children, located at number 10, Awoshika Avenue, Old Bodija, Ibadan. So today we're going to be talking about a very interesting topic, which is diabetics. Let me ask, what do you know about diabetics? And what do you intend to know or learn more about diabetes? That's why we're going to be having this session today. And here with me today is a specialist who loves what he does doing, in person of Dr. Lawal Abimbola. Doctor, thanks for joining us today.
Thank you very much, Esther. Thank you for having me here.
Yes, I know you're a specialist and you know so much about diabetes. So we are privileged to have you today. Thanks for joining us. Doing a little research about diabetes, I discovered that over 6 million people have diabetes in Nigeria. So I need to ask, is that even true, first of all?
Well, it's well over 6 million. I think in 2018, there's a meta-analysis that gave us an estimate of almost about 11.2 million. That's, I think, 2018.
2018.
Yes, of people living with diabetes in Nigeria.
Wow. So 2018 till now, so...
And of course, if you go by the IDF projections, usually more people, sometimes the projections are even exceeded worldwide. Initially we're talking about 538 million thereabouts, but we're looking at that most likely by 2025 or 2045, you may have over 600 people living with diabetes.
Yeah.
And of course, this is sub-Saharan Africa, less developed compared to some other nations, but we've also found out that the prevalence is rising even in our society. And just to quickly add that about 50% of people with diabetes are not even aware at all that they have diabetes. So that's just a brief on the details. Yeah.
When I saw the 6 million, what came to mind is like, how many are we in Nigeria that 6 million people even have diabetics as well? So sir, let me ask, what are the symptoms? Because you said over 50% of people don't even really have diabetics. So what are the symptoms of diabetics?
Okay, well, just to clarify, I know the essence of our talk is about diabetes mellitus. And if you look at diabetes mellitus, of course there are various categories, but I'm not going to bore our audience with that. But let me quickly say that the major categories for the purpose of this discussion is to talk about type 1. On a Saturday morning, you're going out and then you see a 70-year-old man in shorts together with his wife, they are doing brisk walk. So it won't be as if, oh, what's wrong with this? You go to many neighborhoods, you see. Sometimes, I remember there was a time I traveled to Lagos and it looked like it was a planned out neighborhood thing. The entire neighborhood came out and we were going to exercise. So sometimes you have neighborhoods that have just those kind of large gatherings planned out and then they have such events. So it's something that we need to, because those are some of the things that will help to mitigate our risk. It has effect on blood pressure, it has effect on blood glucose, it has effect on the heart, and it makes us healthy.
Okay. So let me ask, are there specific or free medications or free medical services? Yes, I think that's one. Free medical services for maybe free checkups, for persons
with diabetes. Okay, diabetes is one of the, it is a common disease and it's something, like I said, that's expensive. Currently, I'm not too sure that the government is completely taking the burden off. It may be easier for those who have health insurance. Not so many people do, except maybe private organizations, organize some trusts, some foundations organize a free health checkup. Well, I know occasionally, I know the state had organized something. Of course, it was all encompassing, not deliberately focused on diabetes. But except that, I'm not too sure that there's any structured out free medical service. Maybe we'll get there someday with more advocacy. And of course, the World Diabetes Day is coming by the corner, so maybe some people may have to get freely tested at such events and all of that.
And like you said, we need to do the tests at like a trusted. So
yes, particularly the glycated hemoglobin. There are standards, so it's not just everywhere. And I must be sometimes somebody has brought A1C and I say, I'm not really sure this is, can we just recheck? And then you find another value that's completely at par, that's completely at disparity with what you are getting. So the lab must be certified. I don't want to bore you with the details of the certification, but it must be at a certified place. So you must be sure that they know what they're doing and they have such technique to be able to particularly the glycated hemoglobin. Maybe with fasting glucose, a lot of labs may be able to do, but the glycated hemoglobin.
Okay, so let's come back to preventions. Okay. Like people will say you can use herbal treatment, you can do the science treatment. In fact, these days most people are advocating. Okay, so let me ask, when we're talking about prevention, some people say herbal and some people say science, but most people say when we do the herbal, it works even better. So what's your take on that, sir?
All right. I think for a long time, at least from what I know, complementary and alternative therapy has been because, competing with orthodox medicine. But this is my take on orthodox medicine versus alternative therapy, complementary therapy. Now, a lot of medications that we use as physicians have been well researched into. Some medications are even taken from herbs, some from animal products, and they have been well researched. If you look at the rigor that a drug goes through, it goes through almost 5 stages of testing. Sometimes it's even first tested in animals before healthy volunteers, some small chunk of patients, a larger chunk is tested all across the world, multi-centers. And what you're looking for is you're looking for feedbacks. You want to know the dosage, is it appropriate, is it low, or is it normal or high? What are the side effects? Some medications are good, but they have very terrible side effects and they have to be stopped. They have to be taken off the markets because it's not as if they are not efficacious in dealing with the disease, but the side effects are a lot. But the question I ask is, so for alternative therapy, who regulates it? Who tests?
Can you give us some advice to persons living with diabetes and at least persons not living with it? What's your advice for them?
Okay, so in wrapping up, what I would say is that know your risk and mitigate your risk. So what that means in essence is for everybody to have a baseline, know what your glucose is, have an idea what your glycated hemoglobin is. Sometimes people are on the edge. They are not in the normal range, they are not in the diabetes range. They are what we call impaired. It could be impaired fasting, impaired glucose tolerance, so that glucose is on the way to diabetes. And knowing at that point can help you because you can be more aggressive with lifestyle modification, with diet, with exercise, and for some people it can revert back. For some people, even if they are still going to develop diabetes, maybe because there are lots of other genetic things, it may delay the progression. For a pregnant woman, if you know, it can be treated in pregnancy, and usually once the baby is out, then they go back to baseline, even though there is a risk of developing type 2 diabetes in the future. But if you know your risk, you can know how to fight it, you can know how to mitigate it, you can know how to eat healthy, you can know how to exercise, you can know how to cut out things that are deleterious to the body, cigarettes, alcohol, all those things. You can be able to cut them out so that they will not promote the risk of developing whether the disease or even the complications. For those that have diabetes, again, know where you are. What's your glucose level like? What's your glycated hemoglobin like? Because that may inform your physician to now know what medications you want to add, whether to remove. What are even the things that's going on? What's your kidney function like? What's your heart function like? What's your cholesterol like? Because all of these things are the things that contribute to the complications. And once they are able to know, then they can plan a treatment. So that would be my advice. Know your risk and know how to mitigate them. There are a lot of things that people say that are not really true, but once you know your risk and you're able to sit down with a physician, they can give advice. And finally, I'll just say, let's eat healthy. These are days when people want to eat a lot of fried things. They think the more money you make, fast food and all of that. Fast food may not be healthy food. but eat a lot of fruits, high fiber diet, drink a lot of water and all of that, and exercise. All of those things are quite helpful. Thank you.
Thank you so much, Doctor. I remembered I didn't ask you where you work at the beginning. So in case people might really need to reach out to you, so at least your little, just like a short intro where you work, where you can reach out to you and all.
Okay, so I don't know, I'm going to modify it. Like you mentioned my name. My name is Abimbola Lawal. I'm an endocrinologist. My number is 0807 107 8592. I think that's as much as I can disclose. Thank you very much.
Thank you so much, sir. We appreciate your time. We say God bless you.